If I was born again, probably I would become a doctor again. I don't know if a neurosurgeon, but having dedicated my life to children, I don't regret it at all. Since I was very young, I knew I wanted to be a doctor. Honestly, I cannot tell you why, but since I was very, very young, I was a child, maybe 8 years old, I remembered I wanted to be a doctor. So as I went on in the medical school, I knew I wanted to do something difficult. So to me, it was like a challenge. Which is the most challenging specialty? Could it be neurosurgery? So let's go for neurosurgery. And at the beginning, I was not very sure this was going to be my specialty. But as time went by, I said, okay, there's so many things to discover, to do here. So it was a challenge again. So I've been moved by challenges in my life. I've been doing pediatric neurosurgery for 28 years. We do all complex neurosurgical cases. So we can attend any patient with a neurosurgical disease. And for instance, we are a very strong team in oncology, epilepsy surgery, and movement disorders. Our group is very strong in craniofacial malformations. We are part of the European network for craniofacial malformations, which is like a seal of excellence. And also, of course, with spina bifida and malformations. We have also vascular cases, which are not so often in children. We have a very nice group of people, not only because they are great persons, but also because they are great professionals. And the very good thing, we have 6 neurosurgeons in the team, mostly women, by the way. So we have a nurse, we have clinical assistants, and we have pediatricians. That means we have a very diverse group and we can cope with all the sides of the problems. Pediatrics is absolutely different. Not only the technical case, which is challenging, of course, but also the family you have to take care of. And this is very motivating. And the good thing is that children, they tend to do okay. They are very strong. They can recover from surgeries much faster than adults, definitely. And they become adults. And that makes your life so beautiful. To me, working with international patients is so interesting, so good. This gives your daily practice like an extra of acknowledgement. I love that. I love talking to different people from different parts of the world, learning about their cultures, learning part of their languages even. But at the same time, it's so challenging because you can imagine if someone's traveling half of the world to Barcelona, it's because they have a complex disease, complex problem they have not been able to treat in their original countries or in their reference departments. Some of them are first case in the world, 5th case in the world ever reported. And again, for those who have been treated before or operated before, usually they have an extra of complexity to achieve good result in the particular cases. This is probably the specialty where technology has made more changes in our daily practice. So for instance, planning of the cases is absolutely amazing. In the past, we have the anatomical landmarks and the clinical information, which is of course very important, and this is the base. But nowadays we can foresee what the surgery is going to be. We can make the whole plan for the patient, for the particular patient, based on their functional imaging, based on their anatomical landmarks, putting everything together in the same platform and doing an approach which we can foresee from the very beginning of the case. That gives you an extra of safety for the patient, but also of results. We have a lot of tools now, of course, augmented reality, very important, more and more about artificial intelligence. We can do great things in advance to the surgery. And probably the next change in the art to come is going to be about robotization. Robots and artificial intelligence all together, they are going to improve not only our planning, our approach to the patient, but the execution of our surgery. I think very often, is it time to slow down a little bit? But there's always something else. I mean, my motivating thing, my motto is the next case. There's always the next case sent to you by a colleague, by another neurosurgeon, looking after you from any other part of the world. So they are looking for you and And the next case is always our motivating thing. Trying to help the next case, more difficult than the previous one most of the times.